Dr. Porteous, as we could learn. But can I acknowledge Dr. Porteous is a surgeon in Orange, long-standing great service, and in the last honours list he's been awarded an OIM for his work. So congratulations.
Thank you, Joe. And thank you, Minister, Ms. Pavey, who I'm sorry I missed when you were in Orange, Dr. Foley, Dr. Williams, and Robin. Thank you very much for this opportunity. As Joe has mentioned, I am Vice Chairman of Cancer Care West, which is a not-for-profit charitable organisation in Orange, which has had as its prime role developing radiotherapy and an accommodation facility west of the Great Divide. We are extremely grateful for the development of the radiotherapy facilities, and it is functioning very well. I'd also like to thank the Minister for her honoured promise of increasing IPTAS. That has been very much appreciated, and I feel that we need to applaud that. I remember seeing you in Andrew's office, and you said, we're going to do it, and you did. It has made travelling for radiotherapy and cancer treatment much more feasible. As regards the radiotherapy service, we have developed the accommodation facility. The radiotherapy service opened in May. We managed to open the accommodation facility in October. They are both functioning fully occupied. The lodge, the Western Care Lodge, has 14 rooms, and we're already trying to wangle ways of trying to fit everybody in. So there was obviously a need for radiotherapy and the accommodation facility. Currently, as of yesterday, I spoke to the radiation oncologist who has come to live in Orange, Dr. Graham Stevens, and I said, what's the situation? And I quote, he said, we're fully occupied. The radiotherapy unit, the linear accelerator, is currently treating 30 to 35 people per day, and there's a 6 or 7 weeks delay before people can start their treatment. This is unacceptably long, and already this year he could recall at least 6 patients who were referred to have radiotherapy in Orange and had to be referred elsewhere because they could not be started on their radiotherapy regime in a reasonable time frame. As you know, we have a second bunker in the department. I understand that federal funding was offered, and I don't know the fine details, but I do understand that $700,000 is needed to fully fit out that second bunker, even after the cost of that second linear accelerator. The department is working very well. They're a young, enthusiastic group of people who have had a tree change from Sydney. We have a full-time live-in Orange radiation oncologist, and we ask that this urgent consideration be given to fitting out this second bunker. Orange at present is the only single unit, single linear accelerated radiotherapy unit in New South Wales. They have single units in Ballarat, Bendigo and Traralgon in Victoria. However, they all have a hub and spoke philosophy and only 2 to 2.5 hours drive to Melbourne.
I guess, Judy, the question you want is, at what stage are the plans for a possible second linear accelerator.
That's exactly right, Joe. I've finalised now by just saying that, please, can we have a time frame for that second linear accelerator, as it's really getting to an acute stage. We know that it's going to be at least a year before it's installed from the time of funding. Thank you very much, Minister. Thank you, Joe.
I'm happy to address that. As you know, I've had a long sort of history with radiotherapy, and Bob and I and many others in this room were when we were bidding for in the last government, and once Orange was built, we all felt it should be supported, and has been supported in every way. I guess the question is for the second linear accelerator, and the perennial problem of Dubbo versus Orange always arises. From a practical point of view, I think we agree that in the short term, it's more practical to have a second linear accelerator in Orange because of the practicalities of how the radiotherapy runs. The first linear accelerator has downtime, and so you need a second one. The planning for Dubbo Hospital is only at stage 1, and at the moment we haven't got the money for. Even if we could get one, both from the feds and from the state, we wouldn't have the money for that. And to me, I think that probably the correct clinical way to go is to push initially for a second linear accelerator in Orange. However, in the plans for the new hospital, because we're working towards that in Dubbo, we should have bunkers ready for when we will have also radiotherapy in Dubbo. As you well know, the way that cancer therapy is going is that intraoperative radiotherapy will be the way of the future. Already there's papers which have been published which show that intraoperative radiotherapy is beneficial in breast cancer, and definitely in some in some brain tumours. So in the future, I'm sure that hospital, well, obviously we won't have brain surgery in Dubbo, but other forms of surgery will probably be that way. So I believe that my short answer is that I believe we should go for a second linear accelerator in Orange, but plan to have radiotherapy in the future in Dubbo as the new plans for the new hospitals are set in place. Len, is that a fair?
While Lynn is coming, I quite agree that once Orange gets to 2 linear accelerators, and it then is an efficient department, at that time there should be the push to have radiotherapy in Dubbo, and with both departments being run linked together to obtain efficiency of appointments and staff.
And as you know, Stuart, Graham already comes to Dubbo and does outreach clinics, so that's already starting to happen. I'm not sure if you're aware, but you know we've put a business case into the department,
yes, and
we're currently reviewing that business case again to see where we can access those funds. So we are planning to progress as quickly as possible with the second LINAC in Orange.
Thank you very much.